Now, welcome back. Many thanks for staying with us. To matters health now, and to will the current Ebola outbreak in the Democratic Republic of Congo be the worst ever? 1 month after the outbreak was declared, experts warned that the Bundibujo species of the Ebola virus could affect more people than the largest outbreak ever, which occurred in West Africa between 2014 and 2016, killing at least 11,000 people. One of the biggest hurdles now is contact tracing, a critical and most effective tool, experts say, is vital in helping curtail the spread of the deadly virus. And as Gloria Milimu reports, tens of thousands of people who came into contact with Ebola patients in DRC are yet to be traced, a gap that could be detrimental to response efforts to bring the current outbreak under control. Take a look.
The Ebola outbreak in the Democratic Republic of Congo is slowly morphing into what health experts warn could be the worst ever. 1 month into the outbreak, despite scaled-up response, health experts fear the outbreak currently being fueled by the Bundibujo species of the Ebola virus could eclipse previous Ebola crises if transmission is not brought under control. More than 28,000 people say to have been in contact with patients diagnosed with Ebola are yet to be traced, leaving major surveillance gaps that could dent efforts in containing the virus. The Africa CDC says that at least 33,000 people should be under observation, yet only 4,112 are being actively followed. Ideally, those who come into contact with an Ebola patient should be identified, monitored and isolated before transmitting the virus to others. However, experts say surveillance teams are struggling to keep pace with the scale of the outbreak, especially in the remote areas. Beyond data, treatment facilities in the epicenter are stretched thin, as mistrust and resistance continue to fuel the spread of the highly infectious disease among communities in DRC. Insecurity has also made it impossible to reach some areas. Responders have also faced continued wave of violence from community members who stormed treatment centers for loved ones diagnosed with the disease. This, they warn, further narrows the window of containing the outbreak. 1 month down the line, and testing still remains one of the major impediments to response in DRC. While the outbreak is no longer confined in DRC, at least 19 confirmed cases and secondary infections have been reported in the neighboring Uganda. However, as the country grapples with the burden of new infections, Uganda hopes to be declared Ebola-free within the next 4 weeks if no new infections are detected. The landlocked nation has now gone 11 consecutive days without registering new infections.
Worked with the Congo government, and these people will tell you what the exact plan to open joint medical camps on the Congo side and announce it. We are here. If you feel sick, come. Don't try to go to Uganda, because there you will delay. Come here, come.
So far, over 800 cases have been confirmed, with 181 deaths emerging from the outbreak that has been ranked the third deadliest.
We need to expedite also the research on the candidate vaccines and treatment. So one thing that Uganda asked is to take part in this, and there are 3 vaccine candidates, 2 monoclonals and 2 antiviral drugs.
At least 59 recoveries have been made, even as Africa CDC and WHO seek to raise at least 67 billion shillings to help with the response. Gloria Milimu, KTN.